Good afternoon and welcome, everyone. Nope. Thank you for joining us today for our presentation by Mariola Espinosa, Associate Professor, Department of History at the University of Iowa, who will be speaking to us on Cuba, US and Public Health, A History of Strained Relations. I am Sandra Morrow, Board Secretary of the Iowa City Foreign Relations Council and host for today's program. ICFRC hosts programs to address topics of international interest. We thank our members and volunteers for their dues and contributions that have made this forum possible since 1983. I want to acknowledge our university and community supporters, the University of Iowa's international programs, and the University of Iowa's honors programs. They contribute vital time, talent, and logistics to our organization. I also thank the Stanley UI Foundation Support Organization for their financial support, and I thank today's special financial sponsors, Mary Gantz and Dave, Denise, and Mike Tiffany. Our programs are made possible by the financial support of these sponsors. Our format today is our usual one. Following Mariola's presentation at about 1 p.m., we will have a 15-minute Q&A from written questions submitted by audience members. You can write your questions on the cards at your table, and they will be collected at the conclusion of our speakers' remarks. Please silence your cell phones and electronic devices at this time. I will also ask that if you must leave early, please do so quietly and without disturbing others. I will also note that we are using disposable products while the kitchen here undergoes a complete renovation. So I thank you for your understanding. Now, without further ado, I would have Chris Squire introduce you to Mariola.
Thank you, Sandra. It's a great pleasure to me to introduce my friend and my colleague, Mariola Espinosa. Mariola is an associate professor in history at the University of Iowa. She's also a member of our Global Health Studies program. She's a prolific scholar. She's a historian of medicine and public health in the Caribbean. Her 2009 book, Epidemic Invasions, Yellow Fever, and the Limits of Cuban Independence, 1978 to 1930, was awarded the Jack D. Pressman Burroughs Wellcome Fund Career Development Award from the American Association for the History of Medicine. In 2010, Mariola was recognized as the Virginia and Derek Sherman Emerging Scholar. She's currently working on a book that looks into medical misunderstandings of fever in the British, French, Spanish, and US Caribbean empires. Please join me in welcoming Mariola.
Good afternoon, and thank you, Chris and Sandra, for the introduction. Thank you, Bill, for the invitation, and Ed as well. I'm very happy to be here and to be able to present to you some of my interests in the history of medicine and public health in Cuba. Just this past week, on August 29th, we marked the 10th anniversary of Katrina. That hurricane that devastated the Gulf Coast, New Orleans, and many communities in the region. In New Orleans alone, the storm surge broke the levee system and flooded the majority of the city. This was a natural disaster, and it was a national disaster as well. One of the first countries to offer aid to the United States 10 years ago was Cuba. International newspapers reported that Fidel Castro had offered to send over 1,100 physicians trained in emergency situations and medical supplies as well, calling for, in the face of a catastrophe, a pause in this historical confrontation between the two countries in order to save human lives. The priority being those crucial 24 to 48 hours after disaster strikes. These same international newspapers reported a week later that the Cuban government had yet to receive a response from the United States government. At the same time, the United States was asking the European Union for aid. As Castro then stated on national television, this is a quote, "Our gesture is sincere does not ask for publicity, does not come with conditions. Even halting the national airlines' commercial flights, Cubana de Aviación, to be able to use all the airplanes available to them to take the Cuban doctors on their less than 2-hour trip to the region devastated by the hurricane. He also stated that he was surprised that Cuba was not mentioned by Washington as one of those countries that had offered aid in the previous week, as he reiterated that what we want is not to criticize or to make trouble for the United States government. We are conscious that the authorities are going through a tough time. And then he asked rhetorically, are they going to reject our cooperation because of things that happened in the past between the two countries? It would be useful to the world and a good example, not only on our part, but also on their part, because these natural phenomena are likely to happen again. Back in the United States, in the same breath, claiming that international aid offers would be free of politics, the White House and the State Department ignored the offer. A spokesman of the Bush administration asserted, when it comes to Cuba, we have one message for Fidel Castro. He needs to offer the people of Cuba their freedom. 10 years have passed, and as tensions between the United States and Cuba begin to fitfully subside, a better understanding of the sources of these strained relationships between the two countries can help illuminate potential stumbling blocks for further progress. My interests, as mentioned before, are in history and in the history of medicine and public health. And I have found in my work that one often overlooked point of contention over the past 150 years has been public health. Diseases and public health have been at the center of Cuban relations since the 1870s. Today I want to tell you more about that history. It is a story of cooperation, it is a story of tension, and it's a story of nations asserting themselves both at the local level as well as the international level. When we think of US-Cuban relations and tensions, today we think of the Cuban Revolution, we think of 1959, we think of the subsequent embargo. When we look at healthcare, this is a point of pride of the Cuban government. And here's one of these healthcare indicator tables I'm going to go through pretty quickly. But the 2013 healthcare indicators, and these are from the World Health Organization, usually they use measures such as life expectancy, child mortality per thousand, the number of doctors available for the population, the expenditures per capita, and the expenditures per gross domestic product. In terms of life expectancy in 2013, in Cuba it's 79 years old, which is really good. And it's the same as in the United States. When we go to child mortality rates, we're talking about the number of children in 1,000 who die before the age of 5. Cuba, we're talking about 6 per 1,000. In the United States, we're talking about 7. So we are in a comparable arena, except for the fact that we're talking about a very wealthy country compared to one that is not so. Now we get to some interesting numbers. Doctors per 10,000 of the population. In Cuba, we have 67.2. In the United States, only 24.5. In terms of expenditures, we see an even more interesting story where Cuba is spending $405 per capita, and the United States are spending over 8,000 of the population. In terms of the gross domestic product, 8.6% spent in Cuba for health. In the United States, is 17.9. So these are the numbers that we see today when we hear about the fact that Cuban healthcare is wonderful. Right? Internationally, we hear about this. This is what is being referred to, these indicators. So how did health become so important to Cuban politics? We learned in school that in 1898, the United States and Spain fought the Spanish-American War, this splendid little war, a quick and easy war, according to US sources. Reasons for the US intervention in the Cuban War with Spain, so US intervention in the Cuban War of Independence, included liberating the Cubans from Spanish tyranny, included getting rid of the last Spanish colonies from the Western Hemisphere. Humanitarian included also geographic, strategic interests, but also they included a threat that Cuba was posing to the United States, and that was yellow fever. Here is some data that I collected from different sources of Havana of yellow fever deaths, ranging from the thousands in 1871, and they go up and down, and I'll refer to a little bit of, explain to you what's going on in that region. Cuba declared war against Spain in 1868, so there's a first war of independence. It's called the 10 Years' War from 1868 to 1878. And we see that those years correlate with a bit of the spike in yellow fever deaths in Havana. And then they go down after 1879, when the nation can then focus again on infrastructure, on health. The colony itself, the colonial government, can help. In 1878, there was a massive yellow fever epidemic in the United States. It caused hundreds of millions of dollars in losses. It caused more than 20,000 people perished. Over 120,000 people were struck by the disease. And it traveled up the Mississippi Valley from New Orleans as far north as Illinois and Iowa. And this epidemic was traced back, the first case, to a ship that had arrived in New Orleans from Havana. So in the 1870s, Havana was well known as one of the places where yellow fever was endemic, that is, it's always there, and from where you can get it. Cuba is at war. They're trying to figure out what's going on. 1878, the war ends, and the United States sends a group of experts to investigate the cause of yellow fever. This is the age of bacteriology, that's cutting edge at the time. Scientists are looking for diseases to name after themselves to get Nobel Prizes because they can do it, and with microscopes they can now see bacteria. And so they send experts to Cuba to talk with Cuban experts and investigate what causes yellow fever. They write a report, nothing happens. And so there's a little bit of peace, and there's no more, or well, there's less cases of yellow fever. And then war breaks out in Cuba again in 1895, the Cuban War of Independence. The United States intervenes in 1898. And there's a US military occupation of the island that lasts from 1898 until 1902. And I found that what they end up doing in terms of sanitation efforts is that they clean up for yellow fever. They want to get rid of this disease. And so they have these brigades that go around Havana cleaning streets. We have street sweepers in the bottom corner, and at the top we see the street sprinklers. Daily they would travel the streets of Havana, sprinkling the streets to disinfect them. They would walk the streets of Havana picking up trash. All of this for yellow fever. It's important to note that the people pictured in this image are Cubans, and they are former revolutionaries. These are people who fought for independence. They're the Mambisas, the heroes of the Cuban people, who, when they faced American authorities, handed their machete and got a broom. And in the United States, all these efforts are seen as humanitarian. This is good. Sanitation is a good thing. The health of people is a good thing. People want to be healthy. A city, an island that had been at war and destroyed, being reconstructed, streets paved, cleaned. All these things are good for people. All the cleaning and sweeping had some effects, but it didn't solve the problem, and yellow fever again struck. And so the US government decided to gather another group of experts under Walter Reed to investigate, again, the cause of yellow fever. And they started with Carlos Finlay, pictured here. Carlos Finlay was a Cuban physician and scientist, one of the people who had been consulted after 1878, when the first group of researchers went to the island to figure out what caused the disease. And as early as 1881, he had published results of his own experimentations that proposed that a specific type of mosquito, picture here, the Aedes aegypti, was the sole vector of disease transmission, building on the work of Ross and Manson on malaria, the idea that there could be some bug that transmits disease. He started doing his own experiments in Havana, and he made observations that this mosquito, this particular mosquito, behaved in the same way as yellow fever, that it could travel on ships and trains, that it could not survive at high elevation or colder temperatures, so neither mosquitoes nor yellow fever were seen at those things. So he made these connections, and then in his laboratory in Cuba did some experimentation and published his results as early as 1881. So back to 1899 and 1900, the American occupying forces are still not listening to Carlos Finlay. But this commission under Walter Reed that is in charge of finding the cause of yellow fever, and they're looking for a bacteriological cause, includes a man by the name of Henry Rose Carter. And Henry Rose Carter was stationed in Havana with the Department of Engineers. And he had previously, when he was stationed in Mississippi, there were two small towns in Mississippi in 1898, so before he went with the occupying forces to Cuba, and he made an observation that there was a time period between the first case of yellow fever and any subsequent cases. Then he called that extrinsic incubation period, meaning the disease has to incubate outside of the human body for 2 weeks before there's a second case of the disease. And he made this observation and published it in 1898. So he's stationed in Cuba in 1899 and 1900, and here we have the two official members of the Yellow Fever Commission. Jesse Laziar is on top, Walter Reed at the bottom. And Jesse Laziar knows Carter, reads up on Carter's work, and meets with him in Havana, and Carter says, listen, you need to talk to the Cubans. You need to talk to Carlos Finlay. He's been proposing this for many years. You've been looking for a bacteria and haven't found anything. I think it's time to really listen to this guy, especially since it makes sense that a mosquito could be the vector if there's this time period of 2 weeks between the first case and any subsequent cases. And so Laziar goes to Carlos Finlay, and during this time Walter Reed is out of town. It's yellow fever season. I don't know why he left. Maybe it's because it's yellow fever season, but he went back north. And so they're doing all this without his knowledge. He would be really upset. In 1900, Laziar gets mosquitoes from Carlos Finlay and starts his own experiments using US volunteers, and gets the first confirmed case of transmitted by mosquito yellow fever under this experiment. Sadly, a month later, in 1900, so that was in August and September, he himself gets sick and dies. And so other people write back to Walter Reed, and he's totally upset about it. He gets on a boat and goes back to the island and finds all the notebooks of these experiments, quickly writes them up for publication, as any scholar onto something good, and goes back and presents it at conferences as this huge finding. Walter Reed does provide really good experiments that are controlled that further proves and determines that indeed it is this particular mosquito and not dirt or filthy airs that cause yellow fever. And so they change all the efforts towards cleaning up for yellow fever to not just cleaning up for yellow fever, but also controlling for mosquitoes, covering wells and cisterns, making sure there was no standing water, fumigating homes. And we see here a huge decline between the occupation, within the occupation years. So 1899, the first official year of the US occupation, you see this spike in 1900. And then by January 1901, it's a little colder, so they're wondering whether the cold got rid of the mosquitoes. But no, in fact, 1901 proves that all the mosquito eradication efforts controlled yellow fever and eliminated from the island of Cuba. So the US occupation, and in order to convince people in the United States about the merits of this occupation, one of the things that they talked about was all these wonderful efforts towards cleaning up and ridding this island of this devastating disease that paralyzed commerce. But yellow fever was not the biggest killer in Cuba. It was not the second, or the third, or fourth, or fifth, or sixth. Cuban physicians were more concerned with tuberculosis. Yellow fever affected foreigners. Yellow fever affected the occupying forces. Yellow fever affected businessmen going to the island to figure out whether they wanted to invest in the devastated sugar economy. Yellow fever affected new migrants from Spain being recruited not just to reconstruct the economies out in the field, but also to whiten Cuba. And yellow fever affected those across the Gulf of Mexico in New Orleans and Florida, the Gulf Coast. So these health reforms during the occupation are not necessarily for Cubans. They were to address the health problems of the United States. And Cuban doctors, while participating in the scientific enterprise of knowledge production, in finding cures and getting their names out there as discoverers of disease, also resented the fact that it took the elimination of yellow fever to turn beds in hospitals to tuberculosis beds. To the point that in 1902, when the US proposes that they are going to leave the island and have it be independent, which was one of the conditions for US intervention in the first place, they attached a Platt Amendment, an amendment to the Cuban and US constitutions, which would be binding agreement between the two countries. The Platt Amendment we know as responsible for Guantanamo Bay existing today. It included clauses that were aimed at controlling who could invest in Cuba, so Cuba could not go into debt with any other country other than the United States. Cuba could not enter into huge trade agreements with any country except the United States. There were all kinds of limitations to the geography of the island. There were territories that were part of Cuba that then became contested, and the Platt Amendment said that these were things that were going to be determined later. But there's a clause in the Platt Amendment that is a sanitation clause. And that clause pretty specifically says that Cuba will be responsible to keeping the island free of epidemic diseases so as to protect the lives of people across the Gulf of Mexico. And after Cuban independence in 1902, because there was this clause, one of the clauses as well, because of this amendment, one of the clauses said that the United States could intervene if there was political turmoil. The first decades, the first years of Cuban independence were years of growth and political turmoil. At one point, there's an election that is contested, and the people of Cuba ask the United States to intervene, saying, the Platt Amendment says that you will help us out, and this election was stolen. The United States government does not want to intervene in 1905, but in the end, because the Platt Amendment is there, and because they're interested, they intervene in 1906. The 1906 intervention was a political intervention, but one of the first things that they do when they intervene is clean up for yellow fever. In addition, they reorganize the Board of Health and create a national Board of Health to make sure that municipalities and provinces are not independently in charge of the health, that is a national enterprise, and that is one responsible for making sure that there is no yellow fever on the island. In 1906, they established inspections every 3 weeks, everywhere. Every single home, regardless of who owned it, was inspected every 3 weeks. Even more infrastructure was built during this occupation from 1906 to 1909. Infrastructure for sanitation. And so after the United States occupation leaves in 1909, the Cuban government is aware and now has proof that if they don't stay clean for yellow fever, perhaps they would be intervened upon. Doctors and sanitarians became Cuba's first line of defense against US intervention. Cleaning up and centralizing health. After the occupation, and there's other occupations, but after this occupation, the fact that Cuban doctors and public health workers worked to keep the United States from having a pretense to invade again meant that they were defending their country. It became a very nationalistic effort. I don't know of any other country whose independence was threatened by a mosquito. Even before the reforms of the Cuban Revolution that we hear about today, public health and medicine has been this central point of Cuban national pride. In the United States, we have thrilling films like Yellow Jack, where the US military volunteers who gave their bodies to the knowledge of fever become these heroes. Walter Reed, a name you all know. In Cuba, we have Carlos Finlay. Here we have these are probably the most minor ways of commemorating these national heroes. There are sculptures to Carlos Finlay, there are museums and institutes. He is one of the heroes of Cuba. And in the first 30 years of the Cuban Republic, a lot of discourse, scientific discourse between the two countries relies on the fact that these two men are seen in opposition to each other as discoverers of something great. Who gets to claim the glory? In particular, because Cuba is spending all this money to clean up for a disease that New Orleans is not spending any money on. The first decades of the 20th century saw an increase in betterment in the health of the people in Cuba, following an international trend. This is due to increased sanitation infrastructure throughout the world and cities, urban improvements like sewering, aqueducts, access to water, clean water, and advances in medical science and bacteriology. Right? So the discovery of different antibiotics as ways of controlling these conditions that are caused by sanitary problems. So it means that one could address bacterial causes of illness with a magic bullet, a pill. And these new technologies that continue to advance throughout the first 30 years of the 20th century. And eventually the discovery of a virus, right? So the idea that there is something else other than bacteria that can cause disease that then gets treated differently, provides a different push for scientists to find this knowledge to make people better. So these first 3 decades, or 4 or 5 decades of the 20th century, you see an increase in the health quality of Cubans. When Fidel Castro rises to power towards the 1950s and overthrows the dictator Fulgencio Batista in 1959, he represented the desires of a large majority of the Cuban population, which was poor, illiterate, underserved, even when in these previous decades, if we look at the numbers, we see that sanitary and medical improvements were being made. These were being made mostly in the urban centers. This inequality between the city and the countryside, in particular between Havana and the rest of the island, are striking. In 1953, the life expectancy at birth in Cuba was 58.8. Now, that might sound not great right now, but it was one of the highest in the developing world, so it was on par with where it should have been. But if you compare life expectancy in Havana to the rest of the island, you have a life expectancy in the city of 62.7. Indicating that there's a huge inequality, in some places much, much lower. In terms of other global development, these types of indicators that political scientists love, and the discrepancy is even further. Hospital beds in Havana, for example, this is one of these measures that we see when we look at developing countries and access to healthcare, is the number of hospital beds. Hospital beds in Havana were 9.6 per thousand, whereas other provinces, the range were 1 bed per thousand to 2.7 beds per thousand. So the inequality within the island itself was really stark when Fidel Castro starts rising to power. And corruption and inefficiency had pervaded healthcare throughout the first half of the century as well. There were all kinds of rhetoric that then the revolutionaries could pick up on and use to gather support from people who wanted these things for themselves, to mobilize people on their behalf. People from all social classes, so not just poor people who didn't have access to these things, but also physicians who felt that improvements in medicine were necessary, that there was this idea of social medicine that was important to them. And it's this revolutionary ideal, in particular, that healthcare is a basic human right to be fulfilled by the Cuban Revolution, that then gets put against the United States internationally. In particular, the fact that the government supported by the United States before the Cuban Revolution, not just in Cuba, but all of Latin America, were violating human rights. And so national health care became one of the first priorities. It is true that about half of the doctors in Cuba left the island in the first years of the Cuban Revolution, including most of the faculty of the medical school. So the early improvements in healthcare of the Cuban revolutionary government were largely made through increasing nutrition to the people of Cuba and access to clean water. The creation of committees in neighborhoods that were in charge of identifying specific needs of their populations, plan activities, and hold doctors and other healthcare workers to account locally. And by doing that, incorporating people all over the different social spectrum within this revolutionary project of healthcare as a human right. Centralizing it, professionalizing it, and extending it would become the solutions to the chronic shortcomings of Cuban healthcare. So when we think of revolutionary public health or public health under the Cuban Revolution, we have consultorios and polyclinicos, which are these physician and nurse team and clinics, local neighborhood clinics. Here we have one with the iconic Che Guevara image, And it says, as a quote, the life of a human being is more valuable than all the gold of the richest man in the world. And so there's this establishment of a network of neighborhood clinics to serve the population, starting from the very local level, working its way up, everybody involved in this revolutionary project. Not just in the cities, but hopefully also to rural areas, which is something more difficult, and the data is difficult to get at. So these would range to serve about 120 families, between 600 and 700 people. The patients can go to any polyclinic where they want. They were located in factories and schools and neighborhoods, and doctors make house calls in Cuba. This is very labor intensive, this is very capital intensive. This is about educating physicians, making sure that anyone who wants to be a physician can get that education regardless of their financial status. I'm just not going to let this fall. So move on. The Cuban Revolution's commitment to health and the country's population is notable in several respects. An anthropologist, Julie Feinsilver, who has been very active in international relations with Cuba, has said that firstly, the government understands that healthcare is the responsibility of the state, that secondly, that this is a social issue, that thirdly, that it's about universal access and about education, and finally, that this is really a national project, right? It's everybody, not just the government. So public health is then a social project that includes every Cuban. And health is of huge importance, not just at home, but also abroad. Domestically as proof of the good that the revolution has brought to its people, but also internationally in foreign affairs. Cuban health policy is also a tool for both winning friends and for striking adversaries. And this is the banner header of the website of the Escuela Latinoamericana de Medicina, the Latin American School of Medicine. The quote, which is the motto of the school, is forging an army of white coats. This school was created in 1998 as a response to the crisis of Hurricane Mitch in Central America, and is fully supported by the government, and it provides free medical education to international students from underserved areas, including parts of the United States, who would not be able to attend medical school in their homes. They get scholarships, they are vetted, and when they get there, they get training in Spanish, and they learn alongside Cuban students. And they're educated in a curriculum that's unlike a Western, quote-unquote, Western curriculum. They are educated in social medicine. It's preventative medicine first, before specialized medicine. So I'm running out of time, and I want to make sure I finish here. We have some images from people in the school. There are all kinds of relations that occur surrounding public health that are international relations. Not only does Cuba have this army of white-coated men or women that can be sent to places that need them, they also use that as a way to train physicians in other parts of the world that can't travel to Cuba to get this education. It's also something that's used in trade. For example, Venezuela has purchased from Cuba the services of over 30,000 doctors, paramedics, other professionals, and advisors in exchange for barrels of oil. These are bilateral trade agreements that have been going on for over a decade now. So when the United States expresses concerns internationally over human rights violations of Cuba on a international platform, Cuba can then turn around and say, well, health is a human right. We provide it for our Cubans and others in other parts of the world. You don't even provide it to your own constituents. So my point here today is that if we are looking at the ways in which relations between the two countries seem to be changing, right? There's this feeling in the United States that it's really happening quickly, when in fact I feel that it's not. It's very cautious. In Cuba, we're still kind of thinking of it as a very slow process. If we go back to the history of the ways in which the two countries have related, in terms of public health and yellow fever, the Spanish-American War, constitutional clauses about sanitation, and then the consequent development of Cuban capabilities in medicine and healthcare. We see the advances in Cuba in science and vaccines that Americans can't wait to get their hands on. But we also notice that these centers of research and medicine are named after these heroes of yellow fever. The Finlay Institute, the Walter Reed National Military Medical Center. If relations between the United States and Cuba are to continue on the positive course that I hope that they are now, we're going to have to keep an eye on issues of public health. Questions of health have long been the source of tension, and if we want better relations, we need to keep these things in mind. Thank you for your attention.
Thank you, Mariola. In a moment, we will begin the question and answer period. Please pass your question cards to our volunteers. At this time, I would like to remind you of our upcoming programs. On Wednesday, September 9th, Tibby Gallis, PhD, Executive Director, Auschwitz Place and Justice Institute, New York City, will present Early Prevention of Mass Atrocities, Fulfilling Our Responsibility to Protect. On Wednesday, September 16th, Andrei Sazovnov, UI Senior International Relations and Russian native, will present Ramzan Kadyrov, leader of Chechnya, Putin's frenemy. Tuesday, September 29th, the first of two programs featuring one of the 34 International Writing Program guests now in Iowa City. These are always special programs. Actually. Is that a little bag? Yep. If anybody happened to leave a little pouch over at registration, that is up here for you to pick up later.
It's yours.
Yeah.
I'll bring it.
Okay, thanks. All right, so for our first question, Mariola, how will Cuba preserve its culture while encouraging ugly American tourism?
Wow. I teach a history of Cuba course, and last semester Obama made his announcement the day after the final exam. And so I quickly wrote my students who had been pondering such questions to tell them, get on the news. I don't know how you do it now these days, but if it's Twitter or whatever, listen to what's going on. This is what we've talked about. I am a historian, and as a historian, I like to be aware of history as events are happening, but I really hesitate to do counterfactuals or think of what's going to happen in the future. The way relations are slowly thawing is very slowly. And I think that we have to keep in mind that there's been all kinds of tourism in Cuba that's not American. And Cuba has made a great effort to encourage that industry because it's a moneymaker, right? So I think that Cuba will welcome American tourism as any other tourism of the world, because Cubans are eager not just to show people what Cuba is like, but also learn from tourists what the rest of the world is like. At least that has been my experience there.
How would the recovering political relationship between US and Cuba affect the public health system in both Cuba and the US?
Do you mind if I read it again?
Oh, of course.
Yes. One of the clearest ways in which Cuban public health can benefit from the, quote, recovering political relationship, it's so well put, between the US and Cuba is access to materials, right? So we think of things changing quickly, but in hospitals in Cuba right now and in medical schools in Cuba right now, you still cannot purchase medicines that are manufactured in the United States or parts for equipment that maybe has been there for a while that is manufactured by American companies. Think of MRI machines and diagnostic equipment, not just treatment equipment. I think that those are the places where I see Cuban health really benefiting from the opening of relations and the end of the embargo, to be more specific. In terms of American healthcare, I am not sure. I think that the system in the United States could be a place where you can learn about how to treat people as humans and as health is a human right. And Cuba has a lot to teach about that.
Is political structure a determinant of the national approach to medicine and public health? For example, the U.S. has specialized, expensive individual medicine versus Cuba, public health for everyone.
Yeah. The political structure of healthcare is one of these things that plays into international relations as well. So you have countries that look to Cuba as an example for, just to give one example, countries that look to Cuba as an example on how to restructure the politics of health, because models that are like the United States or like Europe are not equivalent financially and in terms of development as their situation. So places in Africa that have similar economic conditions and development conditions look to Cuba as an example on how to get health care because they've been successful, because they don't have the resources that a place like Britain or the United States have. So that political structure does work into the ways in which public health is part of international relations. And I'm not sure if I answered the question. Okay.
Well, can I just expand? Is that type of public health approach possible in a country like the U.S. that has not ever been socialist or communist?
I don't know if I can answer that. I'm sorry, yeah.
It's okay.
It's good to think about. These are all great questions to think about. We might not have the answers, but the fact that we're aware of it and thinking about these issues is significant.
How the worth of poor farmer in Cuba changed the incidence of TB in Cuba around the world? I believe that
The work of Paul Farmer.
The work.
Yeah, so I'm not familiar with a lot of Paul Farmer's work specifically in Cuba. I know more of his work in Haiti and his general work in tuberculosis globally. So I'm not sure if I can answer the question. It's one of these things that intellectual exchange, humanitarian aid is not embargoed. And so knowledge about science and medicine and help is not something that is embargoed. So the ability of somebody like Paul Farmer to go to different parts of the world, I mean, he does that, that's his thing. And work on tuberculosis elimination and hopefully eradication. Cuba is just one of the many places that he's been in.
And for our final question, with regards to the Ebola crisis, how many physicians did Cuba send and how many did the U.S. send, as an example?
I don't know. I am a historian with a bad memory, and I know where to find the answers. I just don't have them in my head all the time. But Cuba was one of these countries that did immediately send people over and send help, just like many countries did. So I don't know the specific numbers, but part of the mission of Cuba is to do these things. And it's not just a humanitarian mission; it's a political mission as well. Any other questions that were not written down? Yeah. There's a hand over there. Oh, we have a hand over there.
I think you spoke on public radio?
Yesterday, yes.
And you talked about different levels of medical care that are part of this system.
I mentioned in particular during the special period. So the special period were the years right after the collapse of the Soviet Union, where many subsidies that were coming to the island of Cuba were no longer there. And a lot of what Cubans had to do was pretty much fend for themselves and innovate and live in dire economic conditions. And that's the first time I visited Cuba was during the special period. And I noticed, in talking to people as well, and if I also mentioned this, I don't know if you're familiar with Michael Moore's film/documentary, I think it's called Sicko, that he took Americans who couldn't afford treatments in the United States to Cuba to get treatment. So presenting this idealistic vision of, look, you can do this in Cuba, why can't you do it in the United States that has all the money in the world? Well, it's this outsider's perspective of Cuba. And what I was trying to bring up is that there is a hierarchy of access to resources. When there's not enough medicine for everyone, when there's not enough beds for everyone, even though there's a lot of beds and there's a lot of doctors, then people who have access to power maybe have the possibility of getting better hospital rooms and better medical care, even within a society that talks about socialized medicine like Cuba does. Right? And in Cuba, there is a social hierarchy that has to do with the political party. Right? So access to social markers are correlated to positions in political power as well. Right? Thank you.
Sheikh Guevara is a medical doctor.
Yes.
Trained in Argentina.
Yes. So he's Argentinian, trained in Argentina, went to Cuba, and then was inspired to become a revolutionary because of what he saw in terms of these aspects of missing social medicine. Yeah. Another question?
In your presentation, I heard you say that Venezuelan oil was in exchange for medical support, medical care. My recollection of the way that exchange was presented in our news was that somehow there was a special relationship between Fidel Castro and the Venezuelan president. So I wonder, what is your advice about where we might go to find relatively unvarnished information about Cuba?
I think that you can get good, relatively unvarnished information about Cuba from all kinds of different sources. It's a matter of being critical about all of them. So sources that are coming from the government of Cuba having to do with Cuban politics and having to do with things that make Cuba look good internationally, I wouldn't not trust them automatically, but I would correlate them with other sources like the World Health Organization and then put them together and see if the picture matches, right? So that's one of the ways in which people who study healthcare can make sure that the data coming out of countries on their public health is as accurate as possible. Governments manipulate information all the time. So I think that it's the task of people who read to be critical about the information they're receiving and to see where it's coming from. I'm not quite sure exactly where to go. In the case of Venezuela or any other country, bilateral agreements are not just international, they're about handshakes and personal relationships as well. It's not a unique type of agreement. Yeah. Thank you so much.
So we now conclude our program. On behalf of the Iowa City Foreign Relations Council, I give a big thank you to Mariola Espinosa for her presentation. I also thank our sponsors, the University of Iowa's International Programs, the University of Iowa's Honors Program, and the Stanley UI Foundation Support Organization for their generous support. Again, we also thank today's financial sponsors, Mary Gans and Dave, Denise, and Mike Tiffany. Mariola, as a token of our appreciation, I would like to present you with our very coveted Iowa City Foreign Relations Council mug.
Thank you.
Thank you again for joining us. We are now adjourned.